Coming up on this edition of Being Well, our guest is Dr. Scott Meyer, obstetrician gynecologist from Sarah Bush Lincoln Health System. Our topic this week is focused on having a healthy pregnancy. Dr. Meyer will talk about the things that women should do before getting pregnant to aid in a healthy pregnancy, as well as those things you can do during those 40 weeks so that you and your baby are happy and healthy. We've got a lot of great information to share with you this week, so stay tuned for Being Well. Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Additional funding by Jazzercise of Charleston. Hello, and thanks for joining us for this edition of Being Well. I'm your host, Lori Casey, and today we're talking about having a healthy pregnancy. And my guest is Dr. Scott Meyer, obstetrician gynecologist with Women's Healthcare of Sarah Bush Lincoln. I got all that out.
You did.
Thank you for coming over today. I appreciate that. Tell me first, what prompted you to get into this area of medicine?
It was a good mix of everything I enjoyed about medicine. When you go through medical school, you go through many different clinical rotations, and you kind of find the ones that suit you the best and go toward that direction. For me, my first rotation was obstetrics and gynecology, and from the first time I was involved in the delivery of a baby, it was by far the best thing I ever saw in medicine. I also enjoyed surgery, and I enjoyed getting to know my patients, and obstetrics and gynecology gave me a mix of all of those things. So it was the perfect fit for me.
So tell me, just as an obstetrician gynecologist, what are the areas of women's health care that you cover? Because you do a lot more than deliver babies, which he did this morning, by the way.
Yes. So yeah, I mean, basically it's being involved with a woman in the entire spectrum of her adult life. So from the time she comes in for the first time not wanting to be pregnant and talking about ways to accomplish that, until going through every pregnancy that she wants to have. And then helping her get through the aging process, going through menopause and the changes that she's going to experience throughout her life.
So you do surgeries too. What kind of surgeries do you perform?
A lot of minor procedures, so things like sterilization procedures. If a woman has a miscarriage or an ectopic pregnancy that needs to be addressed in an emergent manner, we do that. And then finally, if a woman has a condition where she requires a hysterectomy, we do that as well. Okay, so the whole scope. Well, today our focus is on having a healthy pregnancy. So let's start by, what's the ideal range for a woman to have a healthy and fairly low-risk pregnancy? It's somewhat difficult to define. Most people consider the ideal age range to be between the ages of 20 and 35. We know that women who are very young when they become pregnant have more complications. They're more likely to have preterm delivery, low birth weight infants. Their babies are more likely to die after delivery. From a socioeconomic standpoint, they're more likely to live in poverty. They're more likely to be victims of domestic violence. They're more likely to suffer depression. Older women, on the other hand, it's more of a physiologic problem. Older women over the age of 35 have diminished fertility. They're more likely to have miscarriages or ectopic pregnancies. They're more likely to have medical complications of pregnancy like hypertension, diabetes, heart disease, and maternal deaths are much more common in older ages. So ideally we want to stay in the center of the age range. That being said, there's certainly healthy women over the age of 35 can conceive and carry a healthy pregnancy, but medical complications definitely increase at an earlier age.
So if you have a patient that comes in and says, I'm ready to have a baby, Dr. Meyer, not pregnant yet, but my husband and I want to start, what would you tell her?
The first thing would be to get rid of the bad habits. Almost 50% of the pregnant women I see smoke at the time they become pregnant.
Really?
And the first thing is to stop smoking. It's the most important thing a woman can possibly do to help her have a healthy pregnancy. Beyond that, it's just being as healthy as possible. So if a woman is overweight before she wants to become pregnant, trying to get closer to an ideal body weight, or trying to become more physically fit before she becomes pregnant is beneficial. Pregnancy is a physically demanding state, and the healthier a woman is before she becomes pregnant is definitely better. Also, women should start taking prenatal vitamins before they conceive.
Okay. What does that do?
The most important component in a prenatal vitamin is folic acid. Folic acid helps decrease the risk of neural tube defects like spina bifida. The problem is that the neural tube closes before a lot of women even know they're pregnant. So starting prenatal vitamins after a woman has had the first positive pregnancy test a lot of times is not terribly beneficial. So if they can start them before they attempt conception, that's when the biggest benefit is attained.
Okay. So what about for women who've been on birth control for several years? Will it take them longer to conceive if they've been on a birth control for more than a few years?
In general, no.
Okay.
It's not it's not a fact of how long they've been on birth control which makes a difference. It's more a matter of how old they are.
Okay.
So a woman who's 35 who's been on birth control for 10 years has lower fertility than a woman who's 25 who's been on birth control for 10 years. The vast majority of contraception available to women is completely reversible within a few days. Birth control pills are out of their system within about 48 hours.
Okay.
So it's not a matter of how long they've been on the birth control, it's more a matter of what their age is and what their underlying fertility is in the first place, as opposed to how long they've been on the birth control. The one exception to that is the Depo-Provera injection. It's a shot that a woman gets every 3 months to prevent pregnancy. It's designed to prevent conception for 3 months. However, in some women it can last 1 to 2 years beyond the last dose.
Okay.
So for women who are on Depo-Provera who are wanting to conceive, I encourage them to get to a different form of contraception sooner rather than later, because it may take a year or more to get out of their system before their fertility returns to normal.
What if a woman has an IUD? Does that have any effect on how long it takes to get pregnant?
Not really. Again, there are 3 different IUDs on the market right now. 2 of them work via hormonal manipulation of the uterus, and those hormones are gone within a few days.
Okay.
The second one actually is a piece of copper, which is spermicidal, and once the copper is gone, it's not effective anymore.
Okay.
So really, they're completely reversible within just a few days.
So what do you tell women? What's kind of the average number of months it takes to get pregnant before they should start thinking about going to the next step of fertility treatments?
I encourage women to try at least 6 months to a year.
Okay.
The odds after 6 months of trying, the odds of conceiving spontaneously definitely decrease. The reality is that most insurance companies won't pay for any form of infertility treatments or even counseling until a woman has been trying for a year spontaneously and has not conceived. It is certainly normal for it to take 6 months to years, even for women who are completely healthy, have normal fertility, their partner has normal fertility. So especially younger women, I encourage to wait at least a year. A woman who's a little bit older in the first place and maybe less fertile up front, I may only wait 6 months.
Because what really is the fertility time frame window in a women's cycle? It's not a couple of weeks. Is it more like a couple of days?
As far as when they're actually fertile?
Yes, yeah.
Well, the ideal menstrual cycle is 28 days, which means a woman ovulates on day 14, and they're most fertile right around that time.
Okay.
There are certainly women who conceive with
can conceive at almost any time.
Right. Because certainly sperm are viable in the genital tract for a week or more sometimes.
Okay.
But we try to target around the date of ovulation as best as possible.
Are there things, we've talked about some of the physical things that women should do before they get pregnant. Are there some mental things that they should start to kind of wrap their head around before conceiving?
Definitely women with underlying mental health issues should have those well controlled before they get pregnant. Pregnancy is an incredibly stressful state, and if a woman has some mental health issues beforehand, they don't get better with pregnancy. If anything, they get worse.
Such as, like, are you talking like anxiety?
Depression, anxiety, bipolar disorder, all those kind of conditions can get worse with pregnancy rather than better. So they need to make sure that they are stable before they become pregnant, and preferably stable on either medications or counseling that are safe during pregnancy. Beyond that, even for women without underlying mental health issues, pregnancy is an incredibly stressful time. There is a lot of anxiety throughout the pregnancy, not only about what's going on with the pregnancy. I haven't felt my baby move in an hour. Is that normal? But also, what's going to happen in delivery? How good a mom am I going to be? And it just is an incredibly stressful time. So they have to be prepared for that. It's not a state where for 9 months you feel a baby move and then out pops a happy baby and you're a mother naturally. So there's a lot of stress involved in the more women is prepared for that, the better. Ideally, having a good social network is beneficial. We definitely know that women with supportive partners or spouses, supportive family, definitely have better outcomes than women who don't have a good social support network.
So let's talk about the care plan for a pregnant woman. She probably takes that first pregnancy test that comes back positive, makes an appointment to see her doctor. What's the care plan for a pregnant woman? How often do they see their doctor?
In general, we start pregnancy care somewhere between 10 and 12 weeks gestation. So when a woman finds out she's pregnant, she needs to, number one, pick a provider she would like to see, and call that office so they can find out, try to determine how far along she really is and get her scheduled for her first appointment. At that first prenatal visit, it's a very thorough visit. We do a complete history, both medical and mental health history. A complete physical exam, and that includes a breast exam, a pelvic exam, a pap smear if that's indicated. There's a lot of blood work that's necessary during pregnancy, and most of that is done at the first prenatal visit to screen for certain conditions that the state mandates we screen for, frankly.
Okay.
And then we also usually do an ultrasound at the first visit to verify that she actually has a viable fetus, and then to verify how far along the woman really is. After that, then the first half of pregnancy, a woman is seen about once a month. So between the first visit and 28 weeks, we see the woman every 4 weeks. There are some genetic tests that are offered usually in the late first or early second trimester to screen for Down syndrome, spina bifida, cystic fibrosis, and a few other genetic conditions. Those are optional tests, but a lot of women opt to have those performed. Usually an ultrasound is performed between 18 and 20 weeks gestation, to look at, basically to evaluate the fetal anatomy. And then beyond that, most of the visits just involve making sure the woman is gaining the appropriate amount of weight, that the baby is growing appropriately, and then answering the many questions that women have. Routine vaginal exams usually don't start till 38 weeks gestation, so we give women a reprieve from their first visit to the 38-week visit in most cases.
So I know a lot of women probably are saying, how much weight should I gain? And what are some of the downsides of gaining too much weight?
Gaining too much weight, number one, can make the labor process more difficult. So if a woman gains too much weight during pregnancy, that also sometimes means a bigger baby. Also, extra body weight sometimes causes additional soft tissue swelling that makes it harder for a baby to get through. The biggest downside of gaining too much weight during pregnancy is then there's a lot more weight to lose after pregnancy. And that's not an easy task to perform. The recommended weight gain during pregnancy has a lot to do with what the woman weighed before she got pregnant. So women who are underweight, we recommend they gain a little bit more. Women who are overweight should gain a little bit less. But we try to keep pretty close tabs on it now.
Yeah, it used to, probably in the old days, it was eat whatever you want, gain however much you want. But back in the 50s, when a lot of Americans or people weren't as overweight as they are now. So if a woman is at a normal weight, what is the recommended amount of weight?
The recommended weight gain for a normal weight is 25 to 35 pounds during pregnancy. The majority of that is actually gained in late pregnancy. So the usual recommendation is a half a pound per week through the first half of pregnancy, and then 1 pound per week through the second half of pregnancy.
Okay. So now you're pregnant. What are some nutritional things that you recommend for women as far as eating to maintain their healthy pregnancy?
Try to eat as healthy and balanced a diet as possible. The recommended caloric intake for a woman is essentially whatever her normal diet is, plus about an extra 300 calories a day.
Okay, so it's not that terribly
much. It's not an extra pizza at nighttime, it's an extra apple at some point during the day. But basically eat a balanced, healthy diet. There are a lot of physiologic changes during pregnancy. Most women suffer constipation, so eating a lot of fruits and vegetables during pregnancy is beneficial from that standpoint. There are certain foods that we recommend women avoid, but in general, not very many. In general, we recommend avoiding long-lived sea fish like sharks and swordfish and things like that.
Because of
the toxin. When they live a long time, they accumulate more toxins. So normal fish is fine. It's just the long-lived fishes we try to avoid. There are some references that say women should avoid lunch meat during pregnancy. In reality, if they like lunch meat and they're worried, they should just heat it to steaming and then go ahead and eat it.
Is that because of the risk of
there's an infection called listeria, which can have extremely adverse effects on the fetus. In reality, that's an incredibly rare occurrence. And I tell women they're more likely to get hit by a car than get listeria. But if they're worried about it, they can just steam their meat steam.
What about caffeine and coffee and soda and things like that?
It's recommended that the caffeine intake be as minimal as possible. It's generally accepted that 1 can of soda a day or 1 cup of coffee a day is probably okay. Definitely higher amounts of caffeine slightly increase the risk of miscarriage, so we try to avoid high caffeine amounts if possible.
Other foods or things that women should avoid? Obviously, alcohol and smoking.
Yes.
Oh.
Beyond that, sushi, things, I mean, anything that's not fully cooked. So one of the other conditions in pregnancy is called toxoplasmosis. Most women think they get it from changing the cat litter.
Okay.
In reality, most women get it from eating undercooked meat.
Okay.
So make sure chicken and foods like that are fully cooked before you eat them, but beyond that, there's not a lot of restrictions.
Well, let's talk about some of the common pregnancy health, well, not health problems, but side effects, morning sickness, joint pain. What causes some of that sort of stuff, and anything that women can do to prevent some of those things?
In general, no. Some of it is certainly genetic predisposition. Morning sickness has a lot to do with the hormones of pregnancy, and the hormones of pregnancy peak toward the end of the first trimester. So most women have morning sickness much worse in the first trimester, and then it tends to get better later in pregnancy. There's also most people believe, somewhat of a psychological component to morning sickness. So women who are more anxious and suffer from depression, things like that, are more likely to get morning sickness, but that doesn't necessarily hold true all the time either. Things like joint pain, again, there's a physiologic basis for them during pregnancy. The high levels of hormones in pregnancy tend to make all the ligaments a little bit more loose, and also there tends to be a smooth muscle relaxation during pregnancy. From a pregnancy standpoint, that's a good thing because the pelvis can flex more, the baby can fit through there easier. But in late pregnancy, it tends to cause a lot of hip pain, wrist pain, knee pain, elbow pain, and there's not a lot you can do about it.
And what about swelling? You hear women talk about their feet and their lower extremities swelling, especially towards the end.
And again, that's somewhat of a normal physiologic response during pregnancy. We counsel women to watch their salt intake and drink plenty of fluids, but even women that are on a complete low sodium diet and drink the water they're supposed to drink still swell. So there's not a lot of good ways to prevent it. Usually it's a harmless condition other than it causes some discomfort.
So if you have your first pregnancy, you go through with a lot of morning sickness, a lot of those side effects, are you going to probably have that in the second, maybe the third, or do you see both?
Every pregnancy is a little bit different. Certainly it seems with morning sickness, if a woman has it with the first one, she's highly likely to get it with the second one. The joint pains and things like that tend to be compounded with pregnancies because after the baby's born, nothing completely goes back to the way it was before the pregnancy, and then when you get pregnant again, those conditions are still already there, and then you have the pregnancy on top of it, things appear to get worse. So a lot of women will tell you, this is a lot worse than my last pregnancy, the baby's riding lower now, and things like that, and that's normal.
Let's talk about some of the more significant health problems that you see with pregnancy, like preeclampsia and that sort of stuff. What are some of the more severe things that can happen?
Well, preeclampsia is one of the worst ones we see during pregnancy. Most of the time, preeclampsia is detected very late in pregnancy, and usually it's cured just with delivery of the baby. Where preeclampsia becomes a bigger concern is if it happens early in pregnancy, and it sometimes necessitates delivery of the baby, sometimes very early. We know women who are less healthy before they get pregnant are more likely to get preeclampsia. So women who are morbidly obese before pregnancy, women who already have underlying hypertension, women who are diabetic before they get pregnant are much more likely to get preeclampsia. Again, women who are very old or very young are more likely to get preeclampsia. It can be a life-threatening condition for both the mother and the baby. So in general, it does result in delivery of the infant, even if it's early, mainly to save the mother's life.
Okay. Are there other things like that, or is that kind of the most common one that can occur?
Preeclampsia seems to be the most common one. Obviously, with our population getting heavier, diabetes is much more common in pregnancy. That tends to not be so much of a life-threatening condition for the mother as it is sometimes potentially a complicating factor for the baby. Certainly, women with diabetes have much larger infants in general. Women with poorly controlled diabetes have much higher risk of stillbirth. And again, sometimes the delivery is necessitated early because the baby is not safe inside anymore, essentially.
Let's talk about, now we're to the end, and we're talking about birth. What determines for you as the doctor to decide this woman's going to have a C-section or not? Because is it the mother that gets to decide that, or is it?
That's kind of a controversial subject. In general, vaginal delivery is considerably safer for the mother. There are certainly conditions where it's not safer, but for the most part, vaginal delivery is much safer on the mother and probably not any more dangerous on the infant. Having a vaginal delivery also makes subsequent pregnancies a little bit safer as well.
Okay.
So if we end up with a C-section with a first pregnancy, that complicates subsequent pregnancies.
Mm-hmm.
So we definitely encourage women to have vaginal deliveries if at all possible. If infants are extremely large, sometimes that prevents us from attempting a vaginal delivery, especially in diabetic women. If the mother has some sort of underlying condition which would make vaginal delivery contraindicated, we perform cesarean sections. There is definitely a push now nationwide for cesarean section on demand, which means the mother can come in and say, I want a cesarean section. From an ethical standpoint, that is acceptable. As long as a woman is counseled about the risks of what she wants to do, it's her body, she can do what she wants to do. From an insurance company standpoint, that becomes an issue, because right now most insurance companies aren't paying for elective cesarean sections. So if a woman comes in and says, I want a cesarean section, I can counsel her about the risks and benefits of doing that, and then she has to decide if she wants to pull a bunch of money out of her pocket to pay for that in most cases. So although it is certainly becoming more popular in certain areas, most of the time it's not performed because of financial constraints.
And then the recovery is longer if you have a C-section. You're in the hospital a little bit longer.
Much longer. In general, a woman who has a vaginal delivery is in the hospital 1 to 2 days after vaginal delivery. After cesarean section, it's usually 2 to 4 days. In addition, women with vaginal delivery go home without very much discomfort. Women with cesarean section usually need pain medicine for a week or more. So they're slower to get up and get around when they get home. They need much more help taking care of their infant when they get home, or taking care of other children when they get home. And they have a much slower return to normal functioning because of the cesarean section.
In these last few minutes, I want to talk about wives' tales or myths. I'm sure you've had many a mother come in and say, I heard this. What are some of the most common ones that you hear that are just completely outlandish?
I have yet to hear any that hold true. The most common ones have to do with the fetal heart rate determining the sex of the baby, and it's usually if the heart rate is above, if the heart rate is high, it's a girl. If it's low, it's a boy. But nobody can tell me what's high and what's low. And I really wish it would hold true. That would save us a lot of ultrasounds, probably. The other one is that if you have a lot of heartburn, you're going to have a baby with a lot of hair. That doesn't hold true.
Okay.
A lot of women believe that they're more likely to go into labor when there's a full moon or when there's a thunderstorm. Again, that doesn't hold true. Beyond that, there's a lot of advice from mothers that I tell people to ignore. I get a lot of mothers telling their daughters to take castor oil to make them go into labor. Don't do it.
Don't do it.
It's not fun.
No, I would think not. And just finally, as we wrap up, just give our viewers out there just a few last things that they should be thinking about to have a healthy pregnancy, even before they get pregnant and during their pregnancy. What are your last bits of advice?
My first piece of advice is don't get pregnant until you're ready to. About 50% of the pregnancies in this country are not planned, and that certainly complicates things both physically and emotionally. For a woman who is planning a pregnancy, be as healthy as you can before you get pregnant. So it's probably beneficial to wait a year to get in good physical health as opposed to trying to hurry up before you get to a certain age, because in general, a healthier woman a year later is going to do better than a younger woman who's not healthy. So if they're not regularly exercising, get into a regular exercise routine. Pregnancy is stressful on the body, and labor is incredibly stressful on the body, and the better physical shape a woman is in beforehand, the better she's going to do. Similarly, any medical conditions that she has should be well controlled before she tries to get pregnant. You shouldn't try and get pregnant 2 weeks after being diagnosed with diabetes. You should have your diabetes well controlled. Make sure your doctor that's controlling your diabetes is comfortable with you getting pregnant before you even attempt it. Okay.
Sounds like we've got a lot of questions we didn't get through, so you know what that means. You have to come back.
That's okay.
Thank you for coming by Being Well today, Dr. Meyer.
You're welcome.
Remember this, you're all excited about a high school dance, and the day of the event, you wake up with a giant zit. Acne happens to everyone at some point or another, and it can be a huge source of embarrassment and stress for many teens. Doctors at Mayo Clinic have tips on how to best prevent and treat teenage acne.
No matter how much you wash your face or apply anti-acne ointment, breakouts still happen.
Some people argue that acne is not a medical disease, but rather a developmental condition because everyone gets acne.
That's the tough truth of youth. The medical term is acne vulgaris, and Mayo Clinic Dr. Don Davis says there are 4 main factors that cause it: overgrowth of skin, clogged pores, oil production, and bacteria called Propionibacterium acnes or P. acnes.
That bacteria grows on our skin all the time, but then once we get one of the other components of acne, which is oil production, the P. acnes has a food source, and then it can grow and multiply easier.
Your immune system fights back, causing redness. Plus, you can get whiteheads and blackheads, which many think are plugs of dirt stuck in pores.
People assume it's due to chocolate or to pizza or to dirt, and a lot of parents encourage their teenagers to scrub their face harder, or the teenager thinks they should scrub their face harder to get out the dirt. But actually what happens is an oxidation reaction between the oil and the bacteria and their byproducts. So instead of having closed skin on top or a sticky plug, the pore is simply congested with bacteria, oil, and bacterial waste. And when this oil gets exposed to the oxygen in the air, it turns brown.
So how do you prevent and get rid of acne? Dr. Davis says start with using your hands to gently wash your face with a mild soap and water. For milder cases, try over-the-counter products that contain salicylic acid or benzoyl peroxide.
And if that doesn't work, Dr. Davis recommends talking to your primary care physician, who can recommend stronger medications such as antibiotics or acid products. And if acne is severe or persistent, dermatologists are there to help.
Dermatologists use isotretinoin for very severe acne.
As you can see here, treatment can work. It does take time. Your skin has many layers, and it takes about 3 months to turn over. But with diligence and the right products, most teens can end up with clearer skin. For Mayo Clinic News Network, I'm Vivian Williams.
Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Additional funding by Jazzercise of Charleston.